Sister Josie, you take it away, and I'll come back at the back end.
Thank you, Jerome. Can everyone hear me okay?
Yes, we can.
All right, awesome. So greetings, everyone. Thank you for being here today. As Jerome mentioned, my name is Josie McCleary. I worked as the County Executive Chief Community Engagement Officer. I consider myself a seasoned public servant and community engagement leader. I believe in building authentic partnerships between government and community, ensuring that resident voices inform policy, practice, and decision making. And once again, I am really grateful to share this space with you all today. We are coming together during a time that feels uncertain for a lot of people. In July of 2025, Congress passed the reconciliation bill that made changes to Medicaid, SNAP, and other benefits that many individuals and families rely on every day. The bill also included policies that are deeply concerning to the immigrant communities and for the organizations that are working hard to support them. So families here virtually, or many, here virtually, this isn't just policy, it's really personal, right? It's affect families of someone that is looking to seek a doctor, put food on the table, or just feel safe seeking help. So today, it's about understanding what changed, what it means to our residents, and how we move forward together. So this virtual space is meant to be safe. There may be fear, confusion, or even anger in this space, and that's all understandable. Our goal here today isn't to overwhelm anyone or to spread worry. Today, we are here to share accurate information, hear from trusted voices, and to remind one another that no one should navigate this alone. So I am honored to be joined by an incredible group of panelists who work directly with individuals and families impacted by these changes. They bring experience from the front lines, serving clients, navigating systems, and advocating for dignity and access. So panelists, as I introduce you, please just give a minute and introduce yourselves and the company or organization that you represent. So I'm going to start, by the way, I see it on my screen. Shakira Hutchison.
Good afternoon, everyone. My name is Shakira Hutchinson, and I am the Immigration Program Director at the Legal Aid Society. I've been practicing immigration law for a little over 6 years now, and I've been the Program Director for 2 years. My organization focuses on representing non-citizens in humanitarian, family-based, and removal defense cases, and we assist folks in 13 counties in the Finger Lakes.
Thank you. Dahlia Wright.
So sorry, Josie. It's a little different when you're in the panel to unmute yourself. So hello, everyone, and greetings. My name is Dahlia Wright. I am honored to be the commissioner for Monroe County Department of Human Services. I'm really blessed to be part of this wonderful panel. So thank you for having me.
Thank you for being here. Irene Sanchez.
Hello, everybody. My name is Irene Sanchez, and I serve as the Executive Director of Enlace, formerly known as the Western New York Coalition of Farm Worker Saving Agencies. Our mission is to promote justice, dignity, and equity for migrants and farm workers through advocacy, education, outreach, and direct services. We empower our communities to achieve self-sufficiency by fostering collaboration among our partners. In addition to direct support, we run an immigration justice initiative, and we have a partnership of 48 member agencies and that work together to identify needs in the community, especially among migrants and farm workers. Thank you, and again, for inviting us.
Thank you for being here. Mitch Gruber.
Good afternoon, everyone. My name is Mitch Gruber. I'm the Chief Impact Officer at FoodLink, which is the regional food bank here in Rochester. And we serve 10 county service area where all told we distribute about 25 million pounds of food a year to individuals and households who are struggling to make ends meet. And it is our job to convene the emergency food network, the food pantries, the soup kitchens, the emergency shelters that make sure that no one goes to bed hungry on any given night. It's an honor to be able to both serve the community in that way and to be able to talk about some of the really, really, frankly, disturbing changes afoot right now with this panel. I appreciate the opportunity.
Thank you for being here, Mitch. And so I have a list of questions that that I have, but definitely when you talk about food insecurities or food injustices is very deep to my heart. Some of the advocacy work I have done, I sit on the Rochester Food Policy Council and done really some work in the community trying to bring healthy foods into their neighborhoods. So I'm just gonna jump off and start with my question, and I'm going to ask this question to the Commissioner, Thalia Wright. And please, I hope it's okay if I call you guys by your first names. Is that okay? Okay. So Thalia, the first question is for you. What immediate impacts are you seeing from SNAP eligibility, right, and benefits changes that households, at the household levels, right? Because we seen them in some of the bigger levels, but in the household levels, what are some of those changes?
Well, if I could just level set a little bit, and it probably would take a whole presentation, but we have a lot of changes through the administration related to SNAP. I just want to give a little kudos and shout out to our Monroe County Department of Human Services team, many partners on this call like Mitch, our county executive and, Congressman Morelli, because, they started really early with us thinking about this before a lot of the directives came back about the changes with SNAP, right? Just regarding the reconciliation bill, Josie, that you mentioned, and, as a community, bringing the different sectors and stakeholders to the table for us to be proactive and work in collaboration on what the needs are for our Monroe County residents. Fast forward, it comes down that there are going to be significant changes to SNAP and Medicaid. We are still waiting for some direction around Medicaid as we're bracing for some of the changes that are going to be implemented. We know right now there'll be changes and related to the requirements, specifically around age, those type of things. But with SNAP, right, specifically, where they've implemented something that we've never had here in New York State, statewide. We've had a waiver for over 30 decades, where individuals that are receiving SNAP did not have to do work requirements. That is going away starting in March, right? We got the new deadline. Individuals that are classified as what we call able-bodied adults with dependents will now have to do either employment, volunteer search work, and there's some other things that they need to do that they can get some exemptions on. I don't want to take the whole panel to do the ABOD 101, but I will plug, we do have a toolkit on the Monroe County DHS website with a lot of the information, and you can definitely always reach out to us because our team has done a phenomenal job of doing numerous outreach with educating community-based organizations and different providers on what these changes are going to be. So I will just leave that there. But as far as what we're seeing on the household level, to your point, I think we got if I could say, a little roadmap to what could be and what is going to be when we had the little scare regarding the federal government pausing SNAP, right? This was around November when we were hearing that individuals may not get any SNAP benefits. It was an immediate impact. It was an immediate impact where you saw that individuals immediately started to reach out to identify where the food pantries were in our community, right? Trying to make sure that they could supplement food. We know, and I'll leave that to my partner Mitch, who's going to talk about the high demand. Sometimes we look at the narrative and we think these, with SNAP families that, these are poor Black and brown families that don't want to work and lazy, and that's not the case. So I'll plug that again around us changing the narrative of what our service recipients look like. We have individuals that are working families that are needing the assistance. We also see an increase in the strain of the household because of everything else that's going on, right? So the rising cost of rent and household needs, the rising cost of transportation, individuals on fixed income. So even the most modest changes and reductions are going to lead to individuals, sometimes, especially for our older adults, choosing between food, medication, right? Um, so again, I can go on and on about this for some time, but I will allow the time for my other panelists. So thank you.
Thank you for bringing that to light, because I think it's very important for conversations like this to continue to have. I know your deputy commissioner, Denise Reed, has done a wonderful job going out into the community and speaking to some of the community-based organizations that are doing the work around SNAP, or the community-based organizations are working with individuals that are recipients of SNAP, and just really bringing that education. So conversations like these are so very important, and because we need to change that narrative, and the only way you're going to do that is to educate folks on what is accurate, right? That accurate information. So Mitch, the next question's for you. What is the relationship between SNAP benefits and the Emergency Food Network? Because I know you work really well with the Department of Human Services around SNAP, as Commissioner Wright just mentioned. But what is that relationship between SNAP and the Emergency Food Network?
Yeah, thank you for the question, Josie. And I just want to make a statement that I hope is at this point fairly intuitive to people. But there is no such thing as hunger in a city like Rochester, New York. That is not just another word for poverty. We live in a place where if you have the means, you can get to some of the greatest grocery stores in the country, in the world, and get any food you want anytime. It's actually a remarkable thing that even despite what it looks like outside right now, I could still go get a pretty decent avocado and a pretty decent orange. But it just requires money to do that. People have to have money in their pockets, both to be able to afford the bills, but also to be able to have transportation to get to the grocery store. It is incredibly challenging and at times impossible for people to utilize public transportation and get to the store, particularly if they have children, particularly if they're trying to buy any significant volume of food to be able to go back on the bus. And that's not a slight to our public transportation system. It's just a reality. So poverty and hunger are different sides of the same coin. So the only way to address hunger effectively in this country is to make sure that people have money in their pockets to buy food. That's precisely what SNAP does. SNAP, which people call it food, I just want to be clear, food stamps, SNAP, synonymous. Food stamps is the old school name from the bill passed in 1964 called the Food Stamp Act, but it's been changed to the Supplemental Nutrition Assistance Program. You'll hear me and probably Commissioner Wright too use the words interchangeably at times. But the reality is that food stamps have been an incredibly effective program in this country, not just an incredible anti-hunger program, but probably one of the most effective anti-poverty programs in the United States of America. And the reality is when people have benefits, when people have money in their pocket, we see the need for food pantries and soup kitchens go down. Every month, it's a regular bell curve. Beginning of the month, when people get their benefits, every single food pantry, soup kitchen, shelter, well, shouldn't say shelter, but certainly every soup kitchen and food pantry see their numbers a bit lower. And as the month goes on, as people's benefits run out, those numbers increase. It's a direct correlation. And so when the federal government decides to ultimately cut SNAP benefits by adding these work requirements, which truly there's no data that demonstrates that work requirements actually increase participation in the workforce. There's no data whatsoever that demonstrate that these work requirements actually reduce people's need for government assistance when it comes to ultimately making ends meet. When the government decides to put these requirements on people, all that happens is that folks inevitably lose their benefits. And instead of only needing the emergency food system for the last week, maybe last 10 days of the month, they're now relying on the emergency food system for oftentimes the entire month. And that is just incredibly, incredibly straining on the emergency food network. I'll end my comments here with just a couple of other quick pieces. I've been at FoodLink for 17 years now. When I started, we were distributing 8 million pounds of food. It was right at the recession of '08. And since then, we have now become a 25 million pound a year food bank. The need has increased threefold, and it's not simply because there are more people who need food assistance. It's oftentimes because inflation in the grocery industry has outstripped inflation elsewhere. It's just harder to pay your grocery bills all the time. And another point that I want to make is that this is also one of the lowest barriers to getting support. We have wonderful support mechanisms from Monroe County, wonderful support mechanisms from a whole bunch of different entities. But the reality is there's no simpler way to get support than to go to your local neighborhood organization, most often a church, see people who you know, people who you've worked with before, and say, hey, can I have a box of food for this month, and receive it from them. The Emergency Food Network has been the most accessible form of social service support, and therefore our numbers keep increasing. But it can't increase exponentially for an infinite amount of time. Eventually, there is, in fact, a breaking point, and we need there to be a good balance between government support and the Emergency Food Network. And SNAP is the key way to do that.
Thank you. Thank you for that, Mitch. You know, you and I have talked many times, and I mean, this is for another conversation, but, you know, our region really has one of the largest in the nation where we produce our vegetables and fruits, but yet, as you mentioned, our residents are going hungry. And I noticed a lot of food waste. And again, that's a whole nother conversation, but I just think we truly need to do better to support our residents. And thank you for all of the work that you have done and continue to do. So I'm just going to pivot and tap into the immigration sides of things. And so my first question is going to go to Miss Irene. And the question is, what are the most immediate and serious impact of the reconciliation bill? I don't like to use the big bad bill, you know, or the big ugly bill. Let's call it what it is, the reconciliation bill on the immigrant families, especially those in mixed status households. And what should families prioritize right now? I mean, this is scary times, right? And so what is the priority? What are those mixed status households? What should they be working on right now?
Thank you, Josie, for that question. The reality is that the bill did impact not only the undocumented immigrants or migrants, but impact anybody in the community, including individuals who have mixed status families. And we call mixed status families where perhaps mom or dad have legal status, or they might not have legal status at the time, and the children are U.S. citizens, so they might have status. And we see that happen often. We have individuals who married and they have their relative, they're petitioning for family, a base petition based on marriage, and they're waiting for that. So all those individuals that do not have U.S. citizenship right now are being impacted by this bill. One of the primary changes was the increase on funding for removal and immigration enforcement. It is the largest in the U.S. history. This bill allocated $170 billion. They tripled ICE budget. And for those who are not aware how big this is, if you look at the budget from the FBI, DEA, ATF, the U.S. Marshal Service, and the Federal Bureau of Prison, this budget is increasing that combined. So that crazy it is. All the enforcement is going into immigration. And that means that there is an increase in traffic stops. There's an increase in workplace rates. There's an increase in interaction with immigration officials. And now the protections that we used to have as U.S. citizens, like you cannot be stopped or detained just because of the color of your skin or the language that you speak, the word constitutional rights that we all believe we're protected. The Supreme Court came back and said, well, they can actually stop you and question you. And now we have a lot of individuals, and as you saw happening in Minnesota, it doesn't really matter the color of your skin. It doesn't matter the language you speak. We are all going to be impacted by this rampant, crazy way in which immigration enforcement is being acting up. And especially now, they are going to be duplicating and triplicating the number of officers that are going to be on the streets, which is going to be extremely crazy. How this is impacting on families. It is increasing the family detentions. It is increasing the risk for family separation. It is increasing the fact that single parents who might not have somebody who can care for the children will end up in the process of foster care, or they will have to find a legal guardian or somebody who can provide assistance to them when the result of immigration matter. And in the past, we used to see how if it was a single parent or a single mom and they didn't have somebody else who can take care of the children, immigration will process that individual, but they will give them time to go back and do the process where they were waiting outside. That's not happening anymore. We have several clients who are single parents. These are moms, and who are being detained and they're brought to jail. And they're putting them in jail. They're not releasing them as they used to do before. And then the children ended up in the social care system. And we're also seeing a pattern of children going to the OOR system, which we can talk about it later. We see a higher immigration fees. There's fees increasing in asylum application, work permits, TPS, you name it. They're really even increasing fees in asylum applications we have never seen before. And now anybody who apply for asylum, even people who are seeking humanitarian relief, people who are escaping a situation when their life are in danger, and they only came with the clothing that they have on, they had to find $100 a year and to pay for this fee, which is completely ridiculous because the process already is extremely difficult and ridiculous. We even have applications that could be even $1,000. So pretty much what we're seeing is the pattern when individuals are not given the opportunity to legalize into the country, and everything is really to enforcement where they do not have legal status. That's really the goal they have. We saw a lot of restrictions in the SNAP benefits and Medicaid and child tax credit, especially for people with lawful status. We're talking about refugees and people with asylum eligibility that now are not going to be eligible for some of the services. And there are programs that in the past they will be eligible if they were lawful status, could be legal permanent residents. And some of this, we see a transfer where a lot of this eligibility will switch primarily for U.S. citizens. That include even funding that goes to nonprofit organizations to which individuals you can serve are no longer going to be eligible if they are not U.S. citizens. So what can we do? We have to educate the community about this shift and changes in policy. We have to continue working together. I'm very excited to be working alongside all these panelists because actually we work with them all the time about the changes that are happening in the community and how we can help families to overcome these challenges, whether it is identifying a standby guardianship or having a family plan in place. One of the things that we're doing in LASE is we launched an immigrant justice initiative back in March that includes emergency family preparedness. And we are meeting with the clients in advance, hopefully in advance. We have, unfortunately, clients that we have met at the detention facility, but we're working with them to create a plan in place so they have somebody who can care for the children, so they know which school that the children go to, if they need, the children need to take any medication, things that can allow the parents to do a plan in place, including a travel form if they decide that they want the children to reunite with them if they're deported. Because again, they're moving very quickly, and we have situations in which by the time that the parent is being detained and they're brought to a detention facility, they're moved so quickly that in a week or two, they're no longer in our area. We're working with them about how to save the documentation. We do an immigration screening, a very thorough immigration screening to determine eligibility, to see if they are in fact eligible for any immigration relief. Although it's extremely complex, it keeps changing. If we have identified people who are immigration eligibility, whether it's a T visa or a U visa or a VAWA, and we have been working very closely with the Legal Aid Society of Rochester and Shakira into making sure that those individuals get the documentation they need to move their cases forward. Again, but that doesn't mean that that's going to prevent them, right? If they have a petition file, but it's a start, it's a process. And also educating the community. Let's continue educating the volunteers and educating everybody about how we can respond to the community needs. And again, I could go on and on and on and on. So I'm going to leave it here because I know Shakira might want to share more. Thank you.
Thank you for all of that, because yes, I think also being very proactive, making sure you have a plan in place and to be able to educate. Education is very important. I know a lot of people want to help, but sometimes the help may not be the right help and you can do more damage. And so, Shakira, this is for you, and I know it's going to piggyback on what Irene was just saying. Can you discuss the immigration related impacts of the big beautiful bill? Okay, I'm just going to leave that there, including which policy changes have most affected your clients and how your organization has responded.
Yeah, I think a lot of what's happening in immigration was just covered by Irene. And as she mentioned, the bill allocates over $170 billion towards immigration enforcement, detention, and deportation. It doesn't actually meaningfully invest in improving the adjudication of immigration benefits or addressing the massive backlog that USCIS, the immigration courts, the consulates have. Rather, it's focused on like an anti-immigrant policy and framework, which really undermines due process. One of the most striking examples of the bill's funding priorities is that it allocates $45 billion towards immigration detention, including for family detention centers. And then it also allocates a relatively small amount of money, $3.3 billion, to the Executive Office of Immigration Review, which oversees the immigration courts. While at the same time, it's limiting the number of judges that can be hired to 800 immigration judges. And just for reference, prior to the Trump administration, there were 700 immigration judges that was handling a caseload of 1.4 million cases. And so when you're increasing the arrest, but then decreasing the number of judges that are able to adjudicate cases, you would think that it would cause an additional strain on the immigration system. And I believed that we would see the immediate effects of this. I thought there's no way that the system can handle this. It'll be okay. But what we're seeing as practitioners is that there's an erosion of due process, right? We're seeing that the country, this administration is entering into what we call asylum cooperative agreements with other countries. And that's essentially countries agreeing to take our deportees. So we are in asylum cooperative agreements with countries like Ecuador, Honduras, Uganda, and most recently St. Kitts and St. Lucia. And so under these agreements, asylum seekers are not able to present their case. These asylum seekers, some of them who have been in this country for many years, have a lot of community ties. They're just being deported to a third country. It doesn't matter if their case is strong or not. We have a merits hearing that was scheduled for Tuesday. And this morning we got a motion to preterm it for them to send the client to Ecuador, a country in which she has no ties. And so we are seeing the immediate effects of this bill. As Irene mentioned, there's a lot of fees. Increase in immigration filing fees. There are new fees for my organization. That's what has been affecting us the most. We represent indigent clients that are not able to afford the filing fees before, when they were a little cheaper. And for humanitarian cases, which is probably 80% of our clients, cases like VAWA, for victims of domestic violence, or U visa applications for victims of crimes, T visa for victims of trafficking, or special immigrant juvenile status applications for children who have been abused, abandoned, or neglected. Historically, those applications were free. And now, as Irene mentioned, there's a cost associated with most of them. The bill increased asylum by $100 annual asylum fee, and it also included a $250 SIJS filing fee. And it allows for the fees to be increased to account for inflation. And so, you know, since the bill has been in place, we've already seen an increase of $10 for inflation. So for our organization, it really hit us hard. We were kind of at a standstill where we couldn't file any applications. Luckily for me, I have a group of people that I work with that really care about our clients. And I can tell you all that, you know, my staff, they were trying to be so creative and thinking of ways to raise funds for our clients, that they started making bracelets. And I actually have some bracelets on, and they say things like vote, resist, good trouble. And if you donated to $5, we would give you a bracelet. We weren't selling the bracelets, but if you donated, you would get a bracelet. And we were able to raise thousands of dollars with these bracelets just by, you know, making a post on Facebook or going to the rally and having them on our wrist and handing them out. You know, that has been helpful, but obviously that's not sustainable. So I knew that this had to be addressed, that we had to meet the need. So I spoke with our management, and we were able to come up with a plan to get donations that are directly for client filing fees. So now we have a tab on our website where you can donate, and the money goes directly towards our client filing fees. We were also selected for a campaign called Carlos Cares, in which the organization raised money that is directly for our client filing fees. And so far, we've raised $12,000. I can say that since the bill has gone into effect, we've been able to pay almost all applications for our special immigrant juvenile status clients, which has been so amazing. We've also been covering our clients' medical fees too, because that is something that's not talked about, is the medical fees that are associated with all of these applications. It can be anywhere from $250 to $500. And we have some really large families of, you know, 13 plus family members that have to pay for these medicals in addition to the filing fees. So the bill has had a huge effect on the immigrant community, and, you know, all of the things that Irene mentioned. In addition, you know, we're seeing that enforcement activities are increasing on the streets. All of that is due to the amount of funding that the federal government was given under the HR 1 bill.
That's a lot, and it's a little depressing. So to the listening audience, how can we help, right? I mean, I know immigration attorneys are specialized in immigration, but there could be attorneys that might be able to help in other forms of ways. Like, what can we do as a community? Because that is a lot. And I know I heard you spoke in past about how many, particularly here in Monroe County, immigration attorneys are, and then your caseload, right? And Shakira, can you just really speak a little bit about that? And Irene too, as well. How can we as a community help you guys?
Yeah, so you mentioned how many attorneys we have. Just the Legal Aid Society has 10 attorneys. And we are actually the largest immigration legal service providers. You know, Just Cause, there's one immigration attorney here. So I think in Monroe County, and Irene, correct me if I'm wrong, but I think there are 17 nonprofit immigration attorneys representing the Finger Lakes region. And last year in 2025, there were over 10,000 cases in the Buffalo Immigration Court, just for some context. But there's a lot that you all can do. We take volunteers all the time, and Just Cause has a volunteer program where a non-immigration attorney can volunteer to assist with immigration cases, some pro se immigration cases. We all do clinics all the time where if you are a family law attorney, you can volunteer for the family preparedness clinics that are taking place throughout the community. There are other ways that you can support as well. For example, we mentioned that ICE received all this money. but yet still Congress is pushing to give even more money to ICE for detention centers. They've already received over $45 billion for detention centers, but they're pushing to receive more funding. So contact your congressman and tell them not to support this funding. At Legal Aid Society, we're looking for bilingual volunteers. If you speak any other language, we would like to have a volunteer list that we can reach out to when we have clinics or outreach events. We have to pay for interpreters to come to our clients' interviews, or if they need to accompany them to a medical, or if we have an outreach event, we have to pay for that. And so if we had a pool of volunteers that we could contact, that would be helpful to our organization. Like I said, you can always donate to any organization that provides services to the immigrant community, engage in advocacy. There's a lot of rallies that are taking place. Join Rochester Rapid Response. That's a great organization to be a part of. They show up whenever there's ICE activity taking place in our neighborhoods. If you're a notary, you can volunteer for our clinics and our outreach as well. The other thing I would say is that immigration policies have been changing so rapidly, and it's so hard for us to get the information out to the people that are actually being affected. So if you work with immigrants, or if you're a member of an immigrant community, whether that's refugees, or even if they're lawful permanent residents who plan on pursuing naturalization, or if it's particular nationalities, Afghans, Haitians, reach out to the legal service providers, reach out to Legal Aid Society for info sessions. It's hard for me as one person to reach out to every single organization that works with these group of people to see if you're interested in a training or info session. But we would love to come to your organizations, or to have an event where we're speaking specifically as to what is happening with TPS ending for Haitians, or how are Afghan nationals being treated when they're applying for immigration benefits, or what's happening in immigration court, what will happen if you're detained, who's subject to mandatory detention. There's a lot happening, and we would love to be able to get the information out to the people who are actually being affected by the change in policy.
Thank you for that answer. Irene, did you want to add anything? Are you?
I just wanted to add the numbers of individuals who were talking about this. We did a research based on the census data, and Rochester in our region has 94,769 foreign-born individuals. That is in Rochester alone, guys. And we only have 25 immigration practitioners, and that include immigration attorneys and Department of Justice accredited representatives. So Enlace is an accredited organization. So we have two Department of Justice accredited, Mimi one, and the other person is Maria Garcia. And that means that we're allowed to practice immigration law. However, out of all of us combined, including Just Cause, the Legal Aid Society of Rochester, Journey's End, Catholic Charities, our partners, it's only 25 of us to handle potentially 94,000 individuals in need. In the Buffalo area. In Rochester, it's only 17. So in Rochester, it's 17 attorneys or immigration practitioners, including the Department of Justice accredited rep, for 80,391 individuals. So the need is very big. So one of the things that we have been doing is that we're partnering. We have weekly meetings with the legal team, and we discuss what the needs of the community is, and we're trying to find different ways to avoid duplication of work. So if you're trying to help an individual, rather than have them call all the legal services organization, pick one, right? And give them a call and send them an email and follow up, instead of telling the person, call everybody. Because one of the things that we notice sometimes, we're helping the same person, and we have 5 different organizations trying to help the same individual, right? Rather than to have one of them doing the intake and identifying if there's any immigration relief. And that's something that we do at Enlace. Clients can call us, people can call us, and we have legal clinics in a monthly basis. We have a legal clinic yesterday with Journey's End. We have one coming up with Legal Aid. And what we do is, once we identify eligibility, we put them to the attorney so they can do the full immigration relief, and from there determine whether they want to pick the case or not. Other thing is, it's very confusing and it's very difficult. So we ask volunteers, please do not give legal advice. I understand that you see TikTok and that you check the videos and you look at these things and you think that you know what's going on in immigration. That cannot be accurate. So please don't do that, because then they come to us and they get upset when we give them different information because the information doesn't match to the information that was provided to them by a volunteer or somebody trying to help them. Let us do our work. We're going to do everything we can from the bottom of our heart. We're not here because of the money. We're here because this is a passion and desire. We have to help people. We're trying to help the most people as possible. If you want to help, volunteer. There is tons of ways that you can volunteer. You can deliver food. You can help to make connections for taking clients to doctor's appointment. You can help by contacting rapid response. That way you can be trained so you can be deployed and help if there is immigration enforcement. You can also support us legislatively. We need to pass the New York for All, right? We need to stop the law enforcement collaboration with Border Patrol and ICE. And that's something that we need all the residents, not only nonprofit organizations, advocating for this, because we run an anti-labor trafficking program. And the reality is my clients are afraid to go to law enforcement. They are afraid to speak with the police. They are afraid to speak with someone who can, for us, we will protect you. It's like they will protect you. That, they care about you. They don't see it that way, because when they see them working directly with Border Patrol or with ICE, they immediately assume that they're going to turn them to immigration. And that means family separation. It might mean that they will go back to a home country that he will be killed or she will be killed, or they will be raped, or they will be assaulted, or who knows what's going on in that country, or they will never see their families again. So it's very important that we pass New York for All. So again, volunteer. All these organizations were extremely underfunded. We are doing way more than what we had the capacity to do. So just meet with us. Everybody has a volunteer portal. You can go to our volunteer portal. We're launching a Train the Trainer program that is going to start in February 1st. And this Train the Trainer is going to be training everybody 20 hours, immigration enforcement, everything about immigration law, everything about how you can advocate and help. But let's do it in a way that support the work and the messaging in the community. Thank you.
Thank you, Irene. Thank you. I know for sure the audience, please, if you guys can volunteer, donate, please do so. One thing I do know about Rochester, Monroe County, we are a given city and county. I seen it when the food donation was happening down at Frontier Field, just to see the individuals really come out. So I'm just going to pivot this conversation back to our SNAP and food insecurities. So Mitch, this is for you. What can we do as community to limit the impact of the attack on SNAP benefits from the HR 1 bill? So that's the question, simple. What can we do as community?
Sure. Couple things. First and foremost, every single food pantry and soup kitchen in our area can always use support. Again, FoodLink is the convener of this network. We are the wholesaler for this network, so we're providing significant quantities of food from both governmental sources, our retail partners like Wegmans, big manufacturers, and we're a pretty big food purchaser. We spent $10 million on food last year to be able to get out into the emergency food network. So we provide a lot of that, but every food pantry, every soup kitchen also relies on the volunteer and donations from their community. So I would encourage people to find an organization that is near and dear to your heart and to spend, whether it's time or money or energy, or whatever the case may be, to support. And if you're looking for a list of all those food pantries, if you go to foodlinkny.org, right in the top right corner, big red button, it says Find Food. You'll see a map with all the food pantries and soup kitchens in our area. So I would go to one of those, look at, see how you can help them. That is first and foremost. Our work collectively is to make sure that no one goes to bed hungry on any given night. And fortunately, there is a lot of food right now available. New York State did step up in a lot of ways to make sure that there's more food in the emergency food network, but it never hurts to have people who are helping on the ground. The other piece is, I don't think either Dali or myself are able to get into all of the weeds necessary to talk about all the changes in SNAP right now caused by HR 1. But the big picture here is that any major cut, there's huge changes to SNAP in terms of how much government needs to pay. There's going to be massive decisions made by New York State, by Monroe County, by states and counties across the country about how much they're going to be able to pay to continue to support, to pay their new cost share and SNAP benefits. But the biggest way that individuals are going to be hurt or impacted are through these work requirements. And I want to remind people, this is actually, in a lot of ways, I'm a lot more concerned about what's going to happen in rural communities where there are, quite frankly, very little to sometimes no job opportunities for people to go find these allegedly available work requirements. In Monroe County, in Rochester, what we need to do collectively is make sure that every single organization is figuring out how can they offer either work or volunteer opportunities. I want to repeat, volunteering and community service is potentially an eligible way to achieve the work requirement. If we all work together and create some of these volunteer opportunities, even some of the ones that Shakira and Irene were talking about, there's a way to meld some of this work. Every single organization right now that is working on the terrible, oftentimes nefarious realities of HR1 are all relying on people to volunteer and step up. If we can also provide those volunteer opportunities for people who are currently receive SNAP benefits and who need to achieve a work requirement, it can be a win-win. So right now we are working with Monroe County and with Together Now to develop a portal where people will be able to list their volunteer and community service opportunities, and community members can go in and say, look, I can spend 5 or 10 hours a month doing XYZ thing, and therefore be able to actually check off their work requirement as well. To be clear, I believe in the dignity of work. If there are jobs for people, if there's ways we can help people find paid work, we should be doing that. No questions asked. But for a lot of people who are now subject to a work requirement, it is not going to be feasible to find a job that actually checks that box. But if we can find volunteer opportunities collectively, it can lift us all up. And so there'll be more announcements on that to come once this portal is all done. But that is a great way for us to take matters into our own hands and make sure we're giving people opportunities to maintain their benefits and help organizations in need as well.
Thank you, Mitch. Yeah, I hear that call to action, to the audience. If you are working with a community-based organization or you have an organization that have some potential volunteers opportunities, by all means, make sure that you get connected with Together Now. Together Now, I think, is the app that you mentioned, to really get that in there, because I think together as a community, we can really help push this forward. So Thalia, this is gonna piggyback on what Mitch was just saying. So this question is for you, and just to elaborate a little bit more on how is the Department of Human Services working with food banks, housing, workforce, just public health agencies, and coordinating the response, right? The response to TANF and to SNAP changes.
Absolutely. Well, you could tell by my buddy Mitch, because we're talking apples to apples, that we're the time together. Like Mitch could do a DHS presentation at a drop of a hat, right? So I'm so excited about that. But I mean, that's it. Like, I just want to say, we said we're here with family, right? And you see what this panel is made up. There is being built by design, a direct attack around Black and Brown families, our families that are navigating through poverty, right? Our mixed immigration status families, as we heard from Irene, right? And, I was Elevate. We have several of the highest zip codes, concentrated poverty in several of our zip codes here in Monroe County, right? So when you think about it as a whole, every individual is vulnerable when you're living under the poverty level, rather if you're a single family household, this new, like Mitch said, we can spend all day going through some of the new requirements, but when we think about our older adults and the increase in the age requirements, folks that have, retired at 60, and now we're asking them to do volunteer or work requirements to supplement, for SNAP, our veterans, our unhoused population, right? Where before they didn't have to do these work requirements. We're doing so much, as Josie, constructed with are unhoused, and the work that we're doing with Monroe County and City of Rochester for the first time to address these issues. And the more and more we collaborate and do those things to really identify that there are some barriers that are coming back that are going to impede some of the great work that we're doing here, only because so much of the unknown and the consistent changes, and seems like, the target for our most vulnerable individuals in our community. But, I think the blessing is that we are a beautiful community. And when we have concerns and we come together and we educate and we collaborate and we support our community, those are the things that I have found, during my time here as a commissioner, as just a value to DHS as well as a value to the work that we do. So a lot of the work that we're doing right now is really doing a lot of identification, outreach, as Mitch said, building these systems where we could capture information. We didn't wait. We didn't wait for the state to give us our direction and our marching orders, right? We came to the table with so many stakeholders and wonderful providers. For, again, shout out to Together Now, where you can go on the My Wayfinder app today, and there's a screening tool. So if you have any questions or you're working with clients that have any questions, if they're ABOT eligible, it'll walk you through it every step of the way. It'll tell you if you're eligible, what your requirements will be, if you're not eligible, so you don't have to worry as much. We're doing an intentional data drill. We have about 50,000 individuals that are ABOT as we speak, that pretty much are receiving SNAP and working, and may or may not have dependents. Out of that 14,000 we have identified that really, really will now have to navigate through these new rules. So we've been intentional to do some specific outreach to them to ensure that they know what the waiver criteria are. We're in the process of formulating a few things. We're going to work with our county exec's office to do some town hall meetings, because SNAP touches every town, village, city here in our community, to do some education of some of the changes. We're also really intentional about meeting people where they are. So we're going to be co-locating in some of the community-based organizations with our staff at DHS, what we're going to call some clinics with some healthcare providers to do some of the assessments. So for example, like a medical waiver, it's not an intense where we need, right, your whole medical history. It's pretty much a form, an attestation for a physician to just pretty much state that, you can't work, right? At this point, you have some limitations towards working. And it's an easy peasy to do that in a way where we can upload that information, get those individuals a waiver. So right now we're really being intentional. It's a multi-pronged approach with the education and the outreach, really focusing on our community-based organizations. As you know, the Deputy Commissioner Reed and the team has been doing a great job with the roadshow, because we know that, our community goes to the front doors in their communities, and we want to ensure that CBOs have the right information for that. Then the other pieces too is just when we have individuals, it's like connecting families quickly to other services as well, right? Like at the end of the day, there may be some issues around SNAP and, food insecurities, but what we see all the time is you got to look at it holistic, because folks are having issues, with housing payments, right? Housing stability, transportation needs. I mean, all the social determinants that, we talk about all the time. And, it's just a perfect storm right now, because our families are trying to decide how they rob Peter to pay Paul, how they put food on the table, all of these changes that are coming. Right now, my adjutant sits in the seat as, waiting to hear what's going to happen related to TANF, because as you know, the president has also proposed a federal freeze to freeze not only just TANF, child care subsidies, what we call social services block grant funding, which provides all of our preventive funding through the county for our most vulnerable families that support child welfare, foster care placement. So by the grace of God, Letitia James has done the lawsuit with the other states, and we're just hear that the injunction is going to be put in place. it's really sad when you have to say that you're bracing for the worst and hoping for the best, but we have to do that. I hope I don't have to dust off any of the plans that we're putting in place, but in the event that we do, right, we're being as proactive as we can with the information that we have, drilling down on data, working with our community partners like FoodLink, with Enclave like Irene. Um, we're just blessed in that way. And if I may say, this is the time, right? This is the time we all have to step up for community. All that silos and, not working together and this organization. No, we are dealing with the same children and families throughout our community, and they are depending on us to be able to come together and merge resources, think outside of the box, bring services together a little differently. And I'm just so thankful that we have the right people at the helm to do that and who have done that and have offered that assistance. So, you know, we just really uncertain times. I think this conference, right? The title is right spot on because that's what we're navigating. But please know, we are navigating this together, and we are stronger together than as one. So lots of things coming through. And as I always like to say, like Mitch said, there's so much to talk about, but we are here and we're, planning to be out and educate and, need some one-on-one with your organization. We are so willing to come out and have those conversations and provide the presentations.
And I know we are in critical times and we need to fix the system. But in order to fix the system, we have to understand who is being left out and why. And I think we all know who's being left out, but it's knowing the why, right? And I think we have to stick together and to really make sure as a community, as a state, that we are fighting this federal government and we stand together. Dalia, you hit it on the head because my next follow-up question was, who's most vulnerable, right? And to TANF and SNAP. There's a narrative, and someone had said it earlier. It's the Black and brown people who normally get SNAP and use SNAP and all of this stuff. But who's the most vulnerable, and what are we doing to prioritize that, right? What is Monroe County Department of Human Services, Monroe County, the county executive is doing to prioritize support to those individuals? That's for you, Thalia.
Oh, yes. Okay. Yeah. Bringing coming to the table. The blessing of it is that we do have a county executive that is really invested in all that we're talking about. I probably am in his office so much, right? Screaming for the rooftops, just educating about a lot of the changes that are coming down. So having that support at that level, right? Where I'll tell you, I speak to a lot of my peers in other communities that maybe sometimes not so much. But to prioritize is really drilling down on that data, right? Like we all can sit at the tables and anecdotally say, we know the zip codes, right? We all know the zip codes we can read, right? We know who families are, we know what they're navigating through. But to be so intentional, especially when it comes to the changes in SNAP, is to really identify those individuals, those 14,000 that are now going to be required to comply with these new ABOD working rules. And how do we touch them and how do we screen them to ensure that if they are eligible for any of these exemptions, that they are being prioritized. The continued outreach, the continued education, the continued putting things out there in communication, right? The continued partnership that we have with our stakeholders. I can't even say, right? Like we have been prioritized. I keep saying I'm prioritizing my priorities at this point because there's just so many of them. And as we bucket, it's a lot. It's a lot around the education piece, right? The accessing the right individuals, meeting people where they are, ensuring that we are being intentional in how we're planning a lot of our outreach activities, educational outreach, how we're keeping it at the forefront. So individuals, like I said, with the rules coming, March is the first countable month. So we are intentional now to get back to, addressing it, more formally. We had a press conference, Mitch, I can't even remember, a couple of months back. And, at that time, there was a lot of conversations about the proposed federal freezes. So kind of may have gotten a little lost if I feel, we're just really elevating some of the needs around what the new ABOT rules are going to be. So we're going to get back to it and, just working with county communications to see what that looks like, how we might be able to get the county executive, right, back on screen to say, hey, remember I was here, whatever month with that nice envelope? Well, I'm back. And these are the things that we'll have in place hopefully by then, where you'll know where we're having the town hall meetings, right? The ABOT clinics, all of those things. And, not just to come to DHS, we'll come to you and be in forefront in the community where a lot of our individuals go to these trusted organizations because they're right there in their community. So we're doing a lot of work around it. Again, this is my baby, so I can kind of talk about it probably for the whole hour.
Thank you all. We are up and our time is up, but I just wanted to close out and then give you guys 30 seconds to make a closing statement, because I've took on and I heard a lot, and I'm really embracing what I'm feeling in my soul. So as we wrap up, I just want to leave us with this, and I was writing some things down. These policy changes may feel overwhelming, but they do not define us. What defines us is how we respond as neighbors, as community agencies, as advocates, and as community members. Our call to action, and I'm always about call to action today and every day moving forward, is simple but powerful. Stay informed, stay connected, speak up, and show up. Strength doesn't mean doing this alone. Solidarity means that we rise together. And I'm going to end there. And if you guys can just start from Shakira, Irene, Thalia, and Mitch, just give me 30 seconds of closing remarks. I would love to hear what you have to say.
Yeah, thank you, Josie. So 2 points. What's happening in immigration, especially in enforcement that's on the streets, is getting a lot of public attention, but I would challenge you all to please pay attention to what's happening behind the scenes in regards to immigration and the dismantling of legal forms of immigration. That's extremely concerning, and it's going to take years for us to correct what's happening right now. But I do want to end with some positivity. And what I will say about that is that this administration is really trying to flood the zone, and we see it in immigration, but it's in all sectors. They're trying to flood the zone with fear and negativity and hatred and division. And so I'm going to challenge you all once again to flood the zone with love, solidarity, and hope. And let's work together, and especially for our community members, let's be strong and lean on each other. Thank you.
Irene, if you want to go, please.
Sure. I will say that this is a moment that calls for action, not silence. We cannot choose to stay quiet when we see our families being impacted and attacked. And think about, is this a community that you want to leave to your grandkids? It is really what you want to call as a norm now. It is a call for unity. Like Commissioner Wright said, this is time for us to work together, not work on silos. Give grace to the people doing this work, the communities, the people being impacted directly, and find different ways in which we can support each other, because there is a lot of not only work, there is a lot of emotions, and we are going through all of this alongside with the families. As services providers, advocates, and community members, we have to act quickly. That means we have to have stronger partnerships and be proactive and think outside the box. And even though that sometimes you might think that we have never done it that way, that doesn't mean that it's the wrong way. We just have to commute and find different ways to do things to have a different outcome, because we have to support our families. Preparing ourselves for the realities before the crises. Support each other, trust each other, and let's work together towards dignity and humanity. Thank you.
Yeah, I know we're stretched for time, but the words of the great Margaret Wheatley, there's no power for change greater than community discovering what it cares about. And and I'm here, and we care a lot about our community. So we come together, and that power of unity and collaboration, we'll be okay,
Yes.
right? We've been through together, we are together.
Yes. And I am so proud to been employed with Monroe County for 31 years and finally see a mayor and a county executive really embracing that partnership and that unity for the betterment of everyone. So Mitch, I saved you for last because I know you wear two hats, and obviously with Food Link, but also city council member. And so if you just want to close us out and just talk about just what we talked about food insecurities, but then also the sanctuary city, right? How this all ties in and really embracing our sanctuary city status.
Sure. Let me start there and just say that Rochester is proud to be a sanctuary city, and to make sure that folks understand what that means. First and foremost, it means that local resources are not going to be used to assist immigration enforcement. We need to make sure that everybody who lives in this community feels comfortable and feels safe calling local law enforcement. We need to make sure that people who live here are treated as part of the community by every single person who receives a single city tax dollar as part of their salary. And we have made it very clear that that is what the expectation is. We, the legislative body, and also Mayor Evans, we've made it clear that's our expectation. And we had a really, really unfortunate instance and circumstance back in March of last year, and I'm very thankful that we've not heard of another one happening since then. On top of that, we've supported Enlace and their various programs to make sure that we have boots on the ground who are supporting immigrant communities as well. And so that's a really important part of what it means to be in Rochester right now, is know that we are here standing side by side with the folks who make this community stronger, regardless of where they're from. That's going to continue to be the case. And I'm very proud to be an elected official in this city because of that unanimous commitment. I will say, when it comes to the food piece, so much what we talked about is so heavy, and so much, that I understand your questions, Josie, what people can do. And I appreciated Shakira and Irene's answers for sure. There's lots of things we can do across the board, but there's nothing more impactful, and sorry, not more impactful. There's nothing more doable for people than just helping make sure no one goes to bed hungry on any given night. And there are easy, simple things that people can do. Go volunteer to soup kitchen. Go get involved at a food pantry. When you're going to the grocery store to buy some food for yourself, buy a couple extra things and donate them to your local food pantry. That is a way that we can all continue to work together and make this a community that is supporting people. It's one of the reasons why I have been at FoodLink for 17 years, because food is something that can bring people so much comfort. Food is something that no matter how people are feeling, it's a way for us to, when we break bread together, when we know we have food at home and a good meal after a long day, it really changes our mentality. When we eat a good meal, we can go do better at work or do better at school. And we don't necessarily have the opportunity to impact all of the terrible things happening right now as a result of HR1 and other things as well across the world. But what we can do is make sure that our neighbors are well fed. And FoodLink is going to continue to be a leader in that space locally, and we welcome everybody's help and support in helping us get there. And certainly, ABC is a huge part of that. And I'll just say, on a quick plug, I mentioned I've been at FoodLink for 17 years. The only job I had before I was at FoodLink is I was a Head Start teacher for ABC on Hudson Avenue, and I would not be at FoodLink if it wasn't for my experience at ABC. I'm now a proud board member. I know that each and every day, including with conferences like this, ABC helps move the needle as well. I'm really grateful to be part of the organization.
Thank you. Thank you to our panelists. Thank you for your leadership. Thank you for your honesty. Thank you to everyone that's in the audience here with us today and being part of this very important conversation. And thank you most of all for being part of the community. I'm handing it over to you, Jerome.
Wow. Thank you, all of you. I mean, just very, very, very enlightening. What an awesome two Thursdays. Strength and solidarity, rising together through uncertain times. Panelists, I'm grateful for you. Thalia, Josie as host, Mitch, salute. You know, Mitch, like you said, is an ABC board member. And Shakira, I mean, the knowledge that you and where's Irene? Irene is here too, with respect to what's going on, you know, from an immigration point of view is really, really important. And I, as an immigrant to this country, I feel some kind of way about that. But I know that without immigrants, I mean, what would this country be? I mean, just even think about that for a minute. So, but Shakira, what you said that I wrote down and is definitely part of my closing comments. You said, flood the zone with love. Flood the zone with love. And earlier today, on the What About DEI panel, I think it was Marissa who said, caring for others, which is what all of us do, should not be a trend. Caring for others should not be a trend. It is part of our collective moral code. And I'm grateful. Part of our ethos at ABC is kind of what we do with this conference, is to invite partners to talk about their thing and what their lane is and what their skill is, because we cannot do this none of us can do this by ourselves. So we're grateful to so many people who have agreed to be panelists and shared their time and their skill and their talent with us so that we could share it with community.